When it comes to the most effective management for an acute moving into a subacute soft tissue injury, with the most common being things like muscle strains and ligament sprains and tendon or fascia injuries, it was long held and believed that the acronym RICE was the best way to most effectively and expeditiously move somebody from an acute injury on to the next phases of healing. Previously, we thought that resting and offloading pressure from the injured area, applying ice on a semi regular basis for the first few days, providing compression, whether it be through ACE bandages or compression sleeves, and elevating, especially in the case of an extremity, an arm or a leg above the level of the heart, would help to facilitate healing, remove inflammation from the area faster, and ultimately get people out of pain and moving more effectively. Now, this acronym was amended in order to include more along the lines of exercise and recognizing the importance of properly adapting and modifying load, but not avoiding exercise during this acute to subacute phase. We moved into more of the acronym POLICE. Now, that's been amended and updated even more recently in order to eliminate the recommendation for ice, as it's been found that icing and anti-inflammatories can actually slow down the healing process, as the first phase of healing is actually an inflammatory process. And this is essential for us to move into the subacute phase uh, faster versus trying to ice and take anti-inflammatories to blunt this natural part of the healing process. So our most recent acronym in working with people with acute muscle strains, ligament sprains, tendon injuries, again, soft tissue injuries in general, within the first week or so, is to provide some level of relative protection, offload activities that are causing aggravation, that are overstressing those muscles or ligaments, with any swelling that's present, is to elevate that area above the level of the heart if possible. We want to avoid taking too many anti-inflammatories or utilizing ice on too frequent of a basis, again, as this can blunt the first stage in the healing process and ultimately make the recovery take longer than it needs to. We still want to be able to provide some compression locally to the area if possible, and provide education to patients in order to make sure that they have a good understanding of everything that they can do to help expeditiously or expedite their recovery. And then moving into more of the acute to subacute phase, recognize the importance of exercise and movement for recovery, modifying the previous load, again, to avoid aggravating activities, but starting to gradually introduce exercises that do provide or produce a little bit more stress through those muscles or that soft tissue, and then reassessing and seeing how the body and the tissue responds to that increase in exercise or activity level, and using that as a way of guiding whether to do more or less. It is incredibly important that people stay optimistic and positive about realistic recovery timeframes and what all is required in order to recover optimally. And then they found that cardiovascular exercise or getting more blood flow to the healing tissue is super critical in speeding up recovery, as this helps to bring new nutrition into the soft tissue and helps to remove any debris or inflammatory chemicals that are present in that area out of that area, which will reduce pain, improve healing timeframes, and overall function. And then working with a professional to ensure that you are doing the right level of exercise and progressing at an appropriate pace to safely and quickly get back to your desired activity of choice.